I first want to thank you for this opportunity. Like, I've never ever met a African American neurologist before, and so this is such an honor. Like, I don't know, I'm sure I knew there were some out there, but to meet you is like a complete honor. Like, I'm so excited. How did you get started being a neurologist? What made you want to be a neurologist? And how long you've been practicing neurology?
I've been in practice for well over 35 years.
Wow, that's a long time.
That's a long time. And I've always had an interest in the brain and the nervous system, even as far back as high school.
Okay.
I had the opportunity in college to work in a lab doing research in animal behavior.
Mm-hmm.
This gave me a chance to understand how humans and animals behave based on the organization of the nervous system.
Okay.
Later on in medical school, I had I developed an even further interest in neuroscience based on some courses that I took in neuroanatomy, neurophysiology. When I got accepted at the University of Miami to study postgraduate neuroscience as a neurologist, my interest even increased in the area of an area called outcomes, looking at what happens to people after they're injured.
Okay.
How do we improve the quality of their life? So when I was finished with my neurology training, I did a postgraduate fellowship in an area called neurological rehab, neurological trauma. And later on, I became the director of the Neurological Rehabilitation Center at Jackson Memorial Hospital and the University of Miami. So,
wow.
Wow.
I can hear you. You're very experienced. What I could tell.
Well, thank you.
You're welcome. So, what would you say your greatest strength is as a neurologist?
Wow, tough question. It's better that other people answer that question for me. I think the ability to listen to the patient and pay attention to details that others that might not pay attention to.
Okay.
So I think that's, if I were to say I have a strength, I would say that's one of my strengths. I spend a lot of time with my patients.
Okay.
And when you listen to your patients, you learn a whole lot from them.
I'm sure. Wow. So how can someone determine if they had a concussion or a TBI? Like, what's the difference between the two?
A concussion is the less severe form of the disease.
Okay.
Or the condition. And a TBI is generally considered the most severe form.
Okay.
Most people with concussions do not even suffer a loss of consciousness. It's in the rare instance this would occur.
Interesting.
Most people with traumatic brain injury would have had a loss of consciousness, usually for greater than 30 minutes or so. And they would experience something called post-traumatic amnesia, meaning that they're not able to form new memories. And that can last in many cases beyond days, hours to days.
Okay.
Or what you would generally see in a person with a traumatic brain injury would be more structural injury to the brain. For example, hemorrhages, you will see more hemorrhages than you will see in concussion.
Okay.
My battery. So you know concussions with hemorrhage. Well, in the case of a hemorrhage, traumatic brain injury, you'll see more hemorrhage. So in a concussion, there are physiological changes that one would see in the brain that's not structural. In traumatic brain injury, you would see more structural injury to the brain. That's perhaps a simple way of defining it.
So it's possible to have a concussion and not even know it, basically.
Yes, it's possible. Generally, most people with concussions have certain signs and symptoms. Generally, they'll get symptoms like, and they're short-lived generally. But most people with concussions within 7 to 30 days, they would have cleared their symptoms and be functioning normally.
Okay.
That's the literature says. However, what we now know is that many of these patients who have their symptoms cleared up, even after 30 days, once stressed, they may show the effects of concussion in the longer term. Or they may see decline in things like their ability to focus, pay attention. Certainly issues with the emotional states could be impaired. You will see impairment in the emotional states. So clearly those are areas of concern and interest that we would have in terms of people with a concussion.
Okay. Are there any like treatments for concussions? Like is there like or traumatic brain injuries like besides medication? Is there like something else that one would do if they had a concussion? Or I mean, because when you have a TBI, you like you said, it's more severe, so you obviously go to the hospital, whatever, or see treatment from them. But like as far as concussions, if I don't know I had a concussion, then like how do I treat it and it just goes away? Like how does that work?
The patients that have persistent symptoms, generally there are what we call medication treatments, referred to as pharmacological treatments.
Okay.
And there are non-pharmacological treatments. In this case, in the pharmacological case, what you strive to do is to, in as rapid a fashion, eliminate the negative symptoms that the patient might be experiencing. So such as headaches.
Okay.
Very commonly you see dizziness and a condition called vertigo where there is spinning sensation. Spinning sensation could occur in the world around you or yourself could feel the spinning. Most patients with concussions have trouble managing motion in the environment. Anything that moves causes them to feel uncomfortable. They'll get dizzy. Again, they'll feel a sensation of spinning. Some persons would be nauseated and have vomiting spells.
Okay.
So these are all the negative symptoms. They may have, some patients might have double vision or blurred vision, fatigue, diminished energy. Anxiety generally sets in because of these negative symptoms. Sometimes it leads to panic attacks and other emotional states, people becoming emotional, crying very easily for no reason at all.
Okay.
Depression, all of those are common symptoms and signs that the person would experience. Now, the symptoms are what the patient reports, and signs we as physicians or therapists would observe from our assessment or evaluations.
I have your book here. I ordered your book. Let's see, I think last week or whatever, and I'm still reading it, and so I found a couple of things interesting. For one, for the cover, you call it a silent epidemic. Now, when you say silent, is it because it's not like commonly addressed or something like that? Is that why you call it silent epidemic, or why do you refer to it as silent?
Many persons that suffer a concussion, they may get better. And most persons in society would say, okay, there is not an issue here. But later on, when you look at their lives, they may have trouble in school, paying attention, focusing. Trouble with conversation, keeping up with multiple persons talking, tolerating being in a place where there's lots of people moving around, crowds. Or some of the signs and symptoms that we speak about might become evident later on in their lives because of once a concussion occurs, it actually changes the workings of the brain. The brain is a very organized system that's organized hierarchically in a way that it's very complex. You're talking about hundreds of billions of cells with trillions of connections becoming disrupted. Those connections affect your behavior and how you function with your memory, your concentration, your attention. So whenever there is a disruption, then we have these effects. And oftentimes they go unrecognized. And even in the medical community, us as physicians and therapists sometimes miss the diagnosis, and we sometimes diagnose the conditions as other conditions that when it's really a TBI. So it's a silent epidemic also, because when you think about it, 1 in 4 Americans would have suffered a TBI in their lifetime. And today,
Wow.
almost 88%, according to the CDC, of people that have suffered a concussion would go unreported, untreated. And so that's a significant number. So there are lots of people walking around every day that, and many times it's occurred in childhood. You see children running around, falling, hitting their head. Most of us assume that there's nothing there until you evaluate them and see that they have learning issues, trouble with focusing, concentrating, truancy issues. They don't like going to school. They have trouble paying attention and so forth. So those are the real facts. And this is, when you think about it, this is a condition that occurs worldwide, 50 million people per year.